We've prepared this tooth to be filled with amalgam. We've put on a Tafelmeyer for an MOD. There's 2 wedges inserted from the lingual. We've also placed a die-cal base covered with a Copolite varnish liner. We will now proceed to fill this tooth with amalgam. First, we're going to churchurate the amalgam. We'll put an amalgam capsule into the churchurator and churchurate for 10 seconds. We'll remove the capsule. Pouring the contents into the amalgam well. We will recap and dispose of the capsule, knowing that it's empty so it doesn't get mixed up with full ones. We'll then proceed to fill our amalgam carrier. If we go straight into the amalgam a couple of times, it fills the carrier. We're now ready to pass it to our dentist. We will continue to pass our amalgam with the amalgam carrier to the condenser. We will continue to alternate these until our tooth is completely full of amalgam. Once we have completed filling the tooth with amalgam, the assistant will pass the ball burnisher for the dentist to smooth out the tooth. Once the tooth has been smoothed, we will pass the carvers. We'll start with the show A, followed by the discoid cleoid. We'll then pass the explorer to remove the flash, the excess material between the band and the tooth. The assistant will remove any excess amalgam in the oral cavity. The assistant will then come in and remove the Tafelmeyer, starting with the retainer, removing the wedges, and then removing the band, wrapping the band in the appropriate way around the adjacent teeth so as not to damage the filling. The dentist will now re-enter the room and complete any carving with the tooth, starting with the Hollenbach carver. This is for interproximal carving. Followed with the show A or the discoid cleoid to do touch-ups on the occlusal surface. We'll then pass floss. Notice that the floss is pulled out buccally. We'll then remove the dental dam, starting with the ligature. Cutting the septums, being careful not to damage tissue. We'll remove the entire dental dam, frame, and clamp in one piece. The dental assistant will be ready with a 2x2 and saliva ejector to take care of the patient and give a courtesy rinse. Once this is complete, the dentist will check the bite. The assistant will hand a 2x2, the articulating paper, and the mirror. Upon checking the bite if it is high, the dentist will adjust the bite using a carver, most likely the discoid cleoid or the show A. The assistant can suction to avoid getting bits of amalgam into the patient's mouth. our amalgam is complete.